everyone. My name is Oluwaseyi. I also go by Shay for short. I am a Certified Registered Nurse Anesthetist by profession. Welcome, and I am excited to be part of this experience, this platform that you influence, and I hope this inspires a lot of people. So, who are CRNAs and exactly what do we do? So, CRNAs are advanced practice nurses that specialize in the art and science of anesthesia. If you or family members ever had to have surgery or medical procedure, chances are a CRNA was with you throughout that whole perioperative phase, inducing your anesthesia, assessing you, and staying with you through your whole surgery. Okay, so we complete a preoperative assessment on patients, including an airway assessment, pretty much a head-to-toe assessment. We check your lab function, your lab results, and make sure you are in optimal condition for the surgery that you're having that day. Okay, anesthesia is a state of a loss of consciousness, which could include pain relief, analgesia, amnesia, loss of memory, muscle paralysis, and sedation. The sedation could range anywhere from minimal to deep sedation if you're having, for example, like an upper GI endoscopy or colonoscopy. There are different types of anesthesia. There is general anesthesia, which is a loss of consciousness. There is regional anesthesia, which involves numbing a large part of the body. For example, during childbirth, for labor pain, we give laboring moms epidural anesthetic or spinal anesthetic for pain, or local anesthesia, which includes numbing a small part of the body. For example, if you had to have hand surgery or wrist surgery, we can numb that extremity and not your whole body, just numb that extremity so your surgeon can work on that extremity. We also have sedation, which, like I explained earlier, is could be anywhere from minimal to deep sedation for minimal procedures. To be a CRNA, you first have to obtain a bachelor's degree in science or in nursing. The RN in CRNA stands for registered nurse. So first you have to be a registered nurse. And due to the high acuity of patients that we see, really sick patients, you are required to have intensive care experience. So you have to have been an ICU nurse for a minimum of about 1 to 2 years, depending on the anesthesia program you attend, to become a CRNA. And that could be, surgical ICU, medical ICU, neuro ICU, trauma ICU, pediatric ICU, or even neonatal ICU. Then after completing your bachelor's degree and obtaining your RN degree, you would go on to obtain a master's degree or doctoral degree as an entry level to become a CRNA. In addition to classroom and didactic lectures, we also complete rigorous hours of an anesthesia residency program in which we rotate through different clinical sites, including general surgery, including orthopedic surgery, neurological surgery, pediatric surgery, labor and delivery, obstetrics and gynecological, pain management, which could be acute and chronic pain management. There are also opportunities for post doctoral or postmaster's program that offer a fellowship, either like in pain management. You could run your own pain management clinic. I have colleagues who run like a ketamine infusion clinic for patients who have PTSD, post-traumatic stress disorder, or for depression. Or you could also go back and go into education and be a faculty member for an anesthesia program. You can also find us working either as a sole anesthesia provider in a rural setting, or in community hospitals, or in a collaborative setting with a physician anesthesiologist as a team approach. I work in a community hospital setting, and we perform an average of about 50 to 60 surgeries a day, which ranges anywhere from general surgery, orthopedic surgery, podiatry, neurosurgery. And my typical day starts with me waking up about 5:30 in the morning. I know it sounds painful, but we get used to it. 5:30 in the morning, I get ready for work. I usually am at work by 6:30 in the morning. I set up my room. I check my anesthesia machine, my anesthesia equipment. I get my drugs ready, and I go out to say hello and assess my patients, my first patient of the day. We typically do, well, my hospital, my setting right now, we typically work in shifts. So we have 8-hour shifts, 10-hour shifts, 12-hour shifts. And I usually will work till about 3 p.m. Some days I work longer shifts, some days even overnight, and that includes call shifts, especially on the weekends for emergencies like emergency C-sections or traumas or emergency cases that come in. And after my day at work is done, I pick up my toddler son and I start my first work, which is being a mom. So, and it's bright and beautiful. What made you decide to go into your field, and did you always know it was what you were meant to do? Well, I had been a registered nurse for about 10 years before I decided I wanted to go back to school. I enjoyed bedside nursing, and I was comfortable, which is, it was okay. It was great, but I knew I wanted to go back and do something else. I was comfortable. I love what I did, but in working with cardiac surgical patients, I came across CRNAs when they will hand off patients to us in report and give us report, and I was amazed by how astute their skills were and their wide range of responsibilities and how skillful they were. So I shadowed a CRNA at my job place then. I shadowed them for a couple of days just to get a feel of what it was like to be a nurse anesthetist. And I was blown away by what I saw. I loved the autonomy, but still I love the fact that you had autonomy to make decisions, to make critical care decisions all by yourself, and still be able to care for a patient as a nurse. I thought that was quite outstanding. I also love the fact that it offered a dynamic range of opportunities. Like I said, you could work anywhere from an operative setting to a clinic setting, or you could even work in the military. I thought it was quite amazing. So I believe in doing what you do and loving and doing what you love and loving what you do. So for me, becoming a CRNA provided that perfect balance for that mantra, because it offered me a wide range of responsibilities, yet I still maintained the one-to-one interaction with my patients as a nurse. The options are endless being a nurse anesthetist. There are over 50,000 CRNAs in this country, and that number keeps growing. So that speaks volumes for a profession. Which courses in college or high school did you find most beneficial in preparing you for your career path? Well, I started out my career as a registered nurse with an associate degree from a community college. Then I went on to obtain my bachelor's of science degree in biology as an undergraduate. For me, the most beneficial courses that laid the scientific foundation for my career path were science courses. There were biology, chemistry, organic and inorganic, physics, math, uh, anatomy, physiology, and microbiology. Honestly, professional school was very daunting. It was tasking. There was barely any room for extracurricular activities, well, except for if you consider sleeping an extracurricular activity, which I love to do a lot of. But I did manage to maintain a work-life balance by keeping in touch with family, friends. Then we would get together with our friends and do like friendversaries or do friendsgiving. It was a way of maintaining a work-life balance, because I think that was very important for us. We also had a student network for student registered nurse anesthetists at the time to share our experience as students. I remember in my last year of school, I attended an anesthesia conference that was organized by our national body, the American Association of Nurse Anesthetists. Um, I also enjoyed working out. I enjoyed cooking. I thought working out was a way to maintain my mental fitness, my mental health, besides, maintaining a physical health. And I I tried to maintain a work-life balance as much as I could because I thought that was really important. How did you maintain focus to study and prepare for your exams and other coursework in your professional school? Well, as a, a graduate learner, you are an adult learner, and there's a balance between being under the direction of your faculty, your professors, yet you're still accountable for self-study and being self-motivated, because now you're in graduate school, you're in professional school, and nobody's going to hold your hands anymore to do this thing. So I had to create a timetable, a weekly timetable, and I tried to include some fun things in that timetable. I remember my classmates and I, we used something called Quizlet, which was like a flashcard. So it wasn't unusual for us, for you to find us going through flashcards even during lunch break or during our downtime. I thought it was easy for me to use. Then it was electronic flashcards. There were days where I had nothing planned. It was just to catch up with TV series, and I didn't feel guilty about it. You have to create a balance. um my family was very supportive. My husband, we didn't have our son at the time. My husband was very supportive in picking up the reins and keeping our household going, and that I'm grateful for. We also managed, to take, I think in school we got about 2 to 3 weeks a year for vacation. So we managed to take some vacations every now and then, or even a staycation. That work-life balance is very important. I'm a young mom and a wife. I'm originally from Nigeria. I came to the US about 19 years ago now in pursuit of the American dream, and here we are. I love what I do, and I do what I love. I think if I wasn't doing anesthesia, I probably would be doing something food related. I think in my previous life, I was a food connoisseur because I love everything gastronomy. My lifelong dream would be to take a world tour to explore different food options and just take a world tour around the world to taste different foods and different experience. I believe that food and language are two ways to blend into a culture. They're two barriers to break to really understand the culture. Right now I speak Yoruba, which is one of the languages in Nigeria, in Southwest Nigeria, and English and some Arabic. But I would love to learn more languages, Spanish, French, Mandarin, you name it. The world it's just for the taking. I would love to explore more. I believe in doing what you love and loving what you do. I think it is much easier to build a foundation on something that you are passionate about than trying to build several buildings on something that you don't care much about. However, please, please, please do remember that passion alone cannot foot your bills. So, realistically speaking, it's okay. I think it's okay to fund your passionate interest with an interest that you like very much. So if the two align, that's perfect. Good for you. You've figured it out. And if they don't fret it. For example, now I love anesthesia and I love food. If it was left to me, I would probably own a restaurant, go full time into food. But given the times now, is it realistic? Probably not at the moment. But I am okay with funding my interest in food or food services with anesthesia. So that meaning I am okay with funding or with pursuing my passion with an interest that actually foots my bills. Also, please, please do your due diligence, do your research. Um, it's, people are usually eager to get into professional school. I remember in high school, nobody gave us the financial education of the financial impact or the implications of whatever career decisions we made. And people, come out with mountain loads of student loans. Now thinking back at it, it's like, could you have achieved the same goal with your career path with the least amount of financial burden. So please do your research, do your due diligence, and see if there are ways that to go about a path of the least financial burden. Yes, make a plan. It's nice to have a plan, make a plan, but please remember to be flexible with it because life happens and things change. We start out with a plan A, but please don't forget that plan B could also work out. Life happens, things happen, but please don't get frustrated. Stay focused. If you know you want to go, if you know the career path you want to pursue now, great for you. And if you don't, do your research. Go out, talk to people. You'll be amazed by how much knowledge is out there. Not just book knowledge, street knowledge. You'll be amazed by the things you can pick up from people. You can even learn from a little child, from a toddler. You can learn from anybody. Have an open mind. Keep an open mind. The world is your fountain. Go ahead and explore it. You'll be amazed by the things you can learn from people, not just from books, from street knowledge. If you're undecided about which career path to go shadow people, shadow different professions, follow different professionals and see what their day is like. You don't want to be stuck years down the road doing something you hate to do. So take your time, do your due diligence, do your research, and find out what is out there. The world is waiting for you. Just go explore it. One of my favorite quotes is from Steve Jobs' commencement speech at Stanford in 2005. Stay hungry, stay foolish, keep learning. There's so much to learn out there. There's so much to be inspired about. Life is so short. Enjoy it. Maintain a work-life balance. You only live once, so just enjoy it and explore it to the fullest. Listen, you are smart, you're intelligent, you're beautiful, you are great. You are going to do great things. And the end is going to justify the means. Thank you, Due Influence, for this platform. I really appreciate the opportunity, and I hope this inspires somebody to go out and do great things and know that the world is limitless with the opportunities that are waiting for you. It's so limitless. You can be anything and do anything. Just start. Just start. Just go for it. The end is going to justify the means for you, and you are going to do great. Thank you, and stay blessed. Have a good one.